Good afternoon and welcome everyone to the Senate Committee on Health and Human Services for 83rd Legislative Session. Madam Secretary, please proceed to call the roll.
Senator Lang. Here. Senator Stone. Here. Senator Taylor. Present. Senator Titus. Here. Chair Doniate.
And I'm here. Please mark everyone present. Good afternoon, everyone. Welcome to today's meeting. Today, we only have a work session. I know that there's been several revisions to the agenda and the possible consideration of a bill hearing. We are not going to have any bill hearings today. We will just move on to the work session. And so, given that we only have the work session, there won't be any ability to testify on any bills, but we do have a public comment reserved for the end. We will go ahead and begin with our work session, and we will start with AB 185. And I'll turn it over now to Ms. Cooper.
Thank you, Chair. Destiny Cooper for the record. Assembly Bill 185 revises provisions relating to child care, is sponsored by Assemblymember Anderson and was heard in committee on May 6th. Assembly Bill 185 prohibits with certain exceptions the executive board and governing documents of a unit owners association from prohibiting a unit owner from operating a licensed child care facility providing care for between 5 and 12 children. Assemblymember Anderson proposed an amendment which, in summary, allows common interest communities to limit the number of child care businesses that may operate within the community. Adds provisions clarifying child care businesses must adhere to the requirements outlined by the association, including nuance provisions, utilization of common areas, and parking restrictions, amongst other provisions. Thank you.
Thank you, Ms. Cooper. Committee members, any questions on the bill? Senator Lang.
This is for Ms. Cooper, if I could, please. I amended the bill with the sponsor yesterday, and I just wanted to make sure the amendments we worked on are in the bill. For instance, one of them was only one child care facility per 200 households.
Destiny Cooper for the record. Yes, that's reflected in the amendments. If you look at the amendment that's attached, it says detailed amendments proposed to section 1 in subsection A. It says the executive board and the governing documents may impose a limit to the total number of licensed child care facilities of no less than one or no less than one per every 200 units, whichever is greater.
Thank you so much.
Of course.
Thank you. Any other questions? Senator Stone.
Thank you, Mr. Chair, and I appreciate working with the author on all these amendments, including no such activity in condominiums or townhomes, which should have been written in the amendment as well. I just wanted to verify that.
Thank you so much, Senator Stone. Oh,
Yeah.
Ms. Cooper.
Destiny Cooper for the record. Yes, that's correct. And that's also reflected in the amendment. It says remove section 7 and 8 related to the licensure of child care facilities in a multifamily dwelling, apartment, or condominium building.
Thank you.
Thank you.
Thank you. Any other questions? This is a motion of amend do pass. Do I have a motion? So moved. We have a motion from our vice chair. Do I have a second? Second from Senator Lang. Any discussion? Senator Titus.
Thank you, Mr. Chair. I do appreciate the amendments that have been added. Unfortunately, I'm still a hard no on this bill. I know that we need child care facilities. And that's not my issue with the bill. My issue is the government coming in and mandating whatever the business is in a community, saying you will have this business in the community. And so it could be childcare, it could be an ice cream parlor, it could be a dog grooming bill. But regardless, it's the government telling a community what businesses they have to have there. And it's just, in my mind, wrong. So I will be a no. Thank you.
Thank you, Senator Titus. Any other discussion? This is, again, a motion of amend do pass. All those in favor, please say aye. Aye. Any opposed? We have a nay from Senator Titus. Motion's carried, and I will assign that floor statement to Senator Lang. Let's move on to Assembly Bill 282. Ms. Cooper.
Thank you, Chair. Assembly Bill 282 revises provisions relating to billing for healthcare. It's sponsored by Assemblymember Orentlicker and was heard in committee on May 8th. Assembly Bill 282 requires a medical facility or healthcare provider that receives notice from a patient that a medical bill may contain one or more billing overpayments to investigate the alleged overpayment. In that area, I want to just point out that there was an amendment proposed by Assemblymember Orentlicker that changes the word error to overpayment in that section. If a patient contacts the Office for Consumer Health Assistance regarding a medical billing error, the office must notify the medical facility or healthcare provider of the commencement and conclusion of any review of a disputed charge by the office. During an investigation by the office, a medical facility or healthcare provider shall not bill a patient for any care that is subject to the investigation, but may bill a patient for other care. Additionally, in the proposed amendments, they change an entity that bills for these services to a billing entity and adds a definition to reflect as used in Section 3. A billing entity means the provider of healthcare, a provider group practice, or an employer of a provider of healthcare that receives payments for goods or services provided by a provider of healthcare. Thank you, Chair.
Thank you so much, Ms. Cooper. Do we have any questions? I did want to add just one clarification. So in the amendments of the document, the first pages that you see of Assembly Bill 282 towards the bottom, the definition to reflect a billing entity, that was the amendment that I worked with the Nevada State Medical Association, and so that was a reflection of what they submitted, and the Assemblyman agreed to it as well. So I just wanted to make that clear that we're taking the language that they had recommended post-hearing. Any questions? This is a motion to amend and do pass. Do we have a motion? We have a motion from our Vice Chair. Do I have a second? Second from Senator Lang. Any discussion? Senator Titus.
Thank you, Mr. Chair. I appreciate that. I appreciate the working with the NSMA. I will support this out of committee, but may reserve my right. I need some further clarification from the NSMA on that, and so might get to full support at some point. But now I'll go yay, soft support.
We'll take that as a win. Any other comments? All right, let's move on to the vote. All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will take that floor statement. Let's move on to Assembly Bill 350. Ms. Cooper.
Thank you, Chair. Assembly Bill 350 revises provisions relating to cemeteries. It's sponsored by the Assembly Committee on Judiciary and was heard in committee on May 13th. Assembly Bill 350 provides that a cemetery authority shall not disinter or remove certain human remains in all or any part of the cemetery owned, leased, or operated by the authority without a court order. Notice of the court hearing is required, and the court may issue an order if there is a clear and convincing evidence relating to certain circumstances. A written record for each person whose remains are disinterred and removed must be maintained by a cemetery authority. There was an amendment proposed by the American Civil Liberties Union, ACLU, and it clarifies existing rules related to cemetery maintenance and historical sites. Thank you.
Thank you, Ms. Cooper. I just have a quick clarification. I know that there was a question that came up during the hearing about, I know the bill says if a cemetery was designated as historical or with a historical mark, right, that they would be excluded, but there are some cemeteries that are historical that haven't reached such designation. And I believe the amendment reflects that change as was requested. If you can go ahead and clarify for us, please.
Yes, good afternoon. For the record, Kayla Maese, Kaylahmaese. Sorry, I just sprinted up the stairs. I'm out of breath. We did make an amendment to account for native burial grounds and rural cemeteries. So this amendment allows for counties to designate older burial sites as historic based on NRS 381.195. So that will be all cemeteries that were open during the 18th century or 50 years before the current year. So all of those rural ones can be designated as historic. One more time, Kayla Maese for the record, and we did work with NACO, and it was approved by NACO.
And if I might, Mr. Chair, thank you. And thank you for hearing our concerns. And I appreciate that just bringing up that conversation can make a difference, especially in rural Nevada. So thank you.
Of course, Kayla Maese for the record. Thank you for bringing it up as well.
Thank you. Any other questions? This is a motion to amend and do pass. Do you have a motion? We have a motion from our Vice Chair, second from Senator Titus. Any discussion on this motion? All those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will assign that floor statement to Senator Titus. Let's move on to Assembly Bill 448. Ms. Cooper.
Thank you, Chair. Assembly Bill 448 revises provisions relating to insurance revision care, sponsored by Assemblymember Koenig and was heard in committee on May 15th. In summary, Assembly Bill 448 establishes various requirements relating to certain things. So now I want everyone to focus their attention on the mock-up amendment. I know that there was multiple amendments proposed yesterday in different documents, so this is a consolidated amendment created by our legal division. Does everyone have a copy? In summary, it deletes a lot of sections. It adds current language into section 3.1.5, which reads, sorry about that. That includes a vision benefit plan, a vision benefit discount plan, or a contract between a provider of vision insurance and a provider of vision care that is subject to the provisions of this chapter and that is delivered, issued for delivery, or renewed on or after January 1, has the legal effect of including the provisions required by NRS 616A.135 in sections 2 to 34 inclusive. That was the major change between yesterday and today, so I did want to emphasize that on the record. And lastly, amend section 50 to read that the bill becomes effective on January 1, 2026. Thank you.
Thank you so much, Ms. Cooper. Committee members, any questions on this one? Seeing no questions, this is a motion to amend and do pass. Do I have a motion? We have a motion from our Vice Chair. Do I have a second? Second from Senator Lang. Any discussion on this? Before we move to the vote, I just want to express my gratitude to the staff. I know that this has been a lot of changes within the last 24 hours, but our legal staff, of course, have been, and of course our policy analysts were very working behind the scenes to make sure that we got to this moment. So I just wanted to give them a thanks, and of course to the Assemblyman for helping us get to this point as well. With that being said, all those in favor, please say aye. Aye. Any opposed? Motion's carried, and I will go ahead and take that floor statement. Which brings us to our last bill of the day, AB 461. Ms. Cooper.
Thank you, Chair. Assembly Bill 461 revises provisions governing healthcare. It's sponsored by Assemblymember Orrin Linker and Backus. It was heard in committee on May 13th. Assembly Bill 461, with the proposed amendment, removes all sections of the bill with the exception of Section 60 and add language that requires the Guardianship Commission to submit recommendations to the Joint Interim Standing on Health and Human Services. Thank you.
Thank you, Ms. Cooper. I just want to clarify for the record, on this bill, Assembly Bill 461, as Ms. Cooper mentioned, it would add language so it would delete all sections of the bill minus Section 60. That was the section requiring a department to do a program detailing long-term care planning, as the Assemblyman mentioned. And then it would add a new section that would require the Guardianship Commission to submit recommendations to the Joint Interim Standing Committee on Health and Human Services. And that specific requirement of what are they recommending, I'm sure people are asking, it would be for the considerations of such implementation if Nevada were to implement a uniform act as is being proposed. And hopefully by then more states have already considered it and we can see the implications of what other states have already passed. So it's pretty much to send us back recommendations as to what it would look like in our state. Any questions? Senator Titus.
With the recommended changes, then, would that put a fiscal note on this? But I know you don't put fiscal notes on amendments. However, it does change what this bill is doing.
Thank you so much, Senator Titus, for that question. So it's my understanding that it possibly, it would depend on the reprint, but I don't see it as part of this since they're just making recommendations, and it would be through their regular meetings, the public meetings that they do. And it's just to make recommendations. It's not to conduct a full study or anything to that extent. It's just to give us feedback and to do it in an open setting for people to contribute to it. Any other questions? This is a motion of amend do pass. Do I have a motion? We have a motion from Senator Lang. To have a second? We have a second from our Vice Chair. Any discussion? Senator Titus.
Thank you, Mr. Chair. I still am going to be a no on this bill. I just am concerned. I know it's been gutted and there's just a paragraph in there, but there's a lot of changing parts here, and maybe I can be a yes on the floor, but I'm going to be a no for now. Thank you.
Thank you so much, Senator. Any other discussion? All those in favor? Oh, Senator Stone, sorry.
I'll just simply say ditto. I'm going to vote no with the reservation on the floor.
Totally understood. Thank you so much. We'll move on to the vote. Again, this is a amend do pass. All those in favor, please say aye. Aye. Any opposed? We have 2 nays from Senator Stone and Senator Titus. The motion carries, and I will take that floor statement. That concludes our work session for today, and we will now move on to our last agenda item, which is public comment. If you would like to provide public comment at this time, we ask you to please come forward. I don't see anyone here or in Las Vegas. AVH, is there anyone online?
Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much, AVH. That concludes the work of today. Perhaps we'll have meetings next week. Who knows? But for today, we are adjourned.